Have you ever wondered why some pregnant women end up with a catheter? That thing tube doctors insert to help pass urine. Now, before you panic, it's not every pregnancy that needs it, but when it's used, it can be a literal lifesaver for both mother and baby. Today, we are breaking down the real medical reasons why catheters are used during pregnancy, what it feels like, the risk, and the truths many women don't usually hear until they are in the hospital bed. Stay tuned, because by the end of this video, you will know exactly why doctors reach for a catheter during pregnancy and delivery, and whether you should be worried if one is recommended for you. So what is catheter? Let's start with the basics. A catheter is a flexible hollow tube that is inserted into the bladder to drain urine. Normally, your bladder stores urine until you are ready to pass it, but sometimes due to pregnancy complications, surgery or delivery, the body can't release urine properly on its own. That is where a catheter comes in. There are two common types. Intermittent catheter. This one is inserted temporarily to empty the bladder and then removed. Indwelling catheter, that is Foley catheter, stays in place for hours or days, connected to a urine collection bag. In pregnancy and childbirth, it's usually the indwelling catheter that doctors use. Why would a pregnant woman need a catheter? Now to the big question: why insert a catheter during pregnancy or delivery? Here are the main reasons. The first is during labor. When a pregnant woman chooses or requires an epidural anesthesia for pain relief during labor, the lower half of the body becomes numb. That means she may not feel the urge to urinate or be able to push urine out. If urine builds up in the bladder, it can press against the uterus and slow down labor. So the solution is a catheter. It keeps the bladder empty and ensures labor progresses smoothly. The second is before a C-section, cesarean section. During a C-section, doctors insert a catheter before surgery. Why? It prevents the bladder from being accidentally injured during surgery. It keeps the bladder empty, so doctors have a clear space to operate. It allows the medical team to monitor urine output, which is vital signs of how well your kidneys are working during and after surgery. Without this, the bladder could become overfilled and damaged during the procedure. Then the third is urinary retention during pregnancy. Some women develop urinary retention, meaning they can't empty their bladder fully. Causes include the growing uterus pressing on the bladder and urethra, the retroverted uterus tilted backward instead of forward. Conditions like urethral obstruction or severe constipation, if untreated. Urinary retention can damage the bladder and kidneys. A catheter provides relief. The fourth is medical conditions or complications in certain high-risk pregnancies. Catheter may be needed for preeclampsia. Doctors use it to monitor urine output as part of kidney function checks. Prolonged labor to prevent a full bladder from obstructing the baby's descent. Bladder injuries, rare but possible during childbirth. Catheter use aids healing. The fifth is after delivery. Sometimes women have difficulty urinating after childbirth, especially if they had a long or difficult labor. The perineum, area between vagina and anus, was swollen or torn. They receive stitches or an episiotomy. A catheter may be inserted temporarily until normal bladder function returns. So what does it feel like? Okay, let's talk real. Most women describe catheter insertion as uncomfortable but not usually painful, especially if done under anesthesia during labor or C-section. Without anesthesia, it can feel like pressure or a stinging sensation when the tube enters the urethra. The discomfort is often outweighed by the relief of not worrying about a full bladder while in labor or after surgery. So let's look at the benefits versus the risk of catheter use in pregnancy. Like any medical intervention, catheters, come with pros and cons. The benefits: it keeps the bladder empty during surgery and labor. It prevents complications like bladder injury or prolonged labor. It monitors kidney function through urine output, provides relief in cases of urinary retention. The risk: urinary tract infection (UTI). Catheter can introduce bacteria into the bladder. This is the most common complications. Discomfort and irritation: some women feel sore after removal. Bladder spasms: the bladder may contract against the tube. Rare complications: injury to the urethra if inserted incorrectly. Doctors usually remove the catheter as soon as possible, often within 12 to 24 hours after a C-section, to reduce infection risk. So let's look at how long will you have it. Duration depends on the reason for insertion. During C-section, usually removed within a day. Epidural during labor, removed after the anesthesia wears off. For urinary retention, may be used for hours to days depending on recovery. The goal is always short-term use. Long-term catheterization in pregnancy is rare unless there is a severe underlying medical condition. Coping tips for women with catheter during pregnancy. If you or someone you know needs a catheter during pregnancy, here are some practical tips. 1. Stay clean. Wash hands before touching the tube or bag. 2. Drink fluids. Stay hydrated to flush out bacteria. 3. Keep bag below bladder level, preventing urine from flowing back. Then 4. Watch for signs of infection. Burning, cloudy urine, or fever should be reported immediately. Then 5. Stay relaxed. Stress and tension can make the experience worse. Remember, it's temporary and for your safety. Okay, let's bust a few myths. Every pregnant woman needs a catheter. That is not true. Most pregnancies doesn't require one. It means something is wrong with the baby. Not true. Catheters are about the mother's bladder, not the baby's health. It's dangerous to use a catheter. No, the risk exists but are manageable, especially under hospital supervision. Catheters always cause infection. How they increase the risk? Strict hospital hygiene minimize this. When should you worry? If you are pregnant and experiencing difficulty urinating, painful urination, swelling that makes passing urine hard, or if your doctor suggests a catheter but you are unsure why, always ask questions. Understanding the reason behind medical procedures gives peace of mind and helps you make informed decisions. So why is catheter used during pregnancy? In short, to keep the bladder safe, prevent complications, and make delivery smoother, especially during C-section and epidural. It's not something to fear, but rather a supportive tool in modern obstetrics. If your doctor recommends it, remember it's temporary, carefully monitored, and usually removed as soon as possible. And most importantly, it's there to protect both mother and baby. So if you find this video helpful, don't forget to like, share, and subscribe. And I'll see you in the next one. Bye.